Hello students, today we will see about mandible. So this is the mandible. It is also known as lower jaw. It is the largest and the strongest bone of the face. Mandible develops from the first pharyngeal arch, and you can see it is a horseshoe shape in structure. This is a U-shaped or horseshoe shaped structure. Okay, now we will see here the parts of mandible. So this is the body of the mandible. This is ramus. This is coronoid process, and this is condyloid process. Okay, so this is body both side. Both side we have ramus, this and this part. This is coronoid process, and this is condyloid process. Now we will see about the body of the mandible. So it has two surfaces, that is the outer surface and the inner surface. So in the outer surface and inner surface, this is outer surface and this is inner surface. So on the outer surface you can appreciate the symphysis menti. This is the midline where the two body fuses at this middle line. This is symphysis menti, and you can appreciate a triangular protuberance here. You can see this is this triangular protuberance. This is known as mental protuberance. Okay, this is mental protuberance. And inferolaterally, that is inferior or lower, and laterally, that means distal to the midline, this is known as mental tubercle. Okay, the both side we have mental tubercle, and this triangular protuberance is mental protuberance. Now here we have the mental foramen below the two premolars. Both side we have mental foramen below the premolars. Now you can see the oblique line. This is the oblique line, both side. This line extends forward and downward from the ascending ramus till the first molar. This is the oblique line. Now below the incisors we have a depression known as incisive fossa. Below the incisors we have depression called incisive fossa. Here you can appreciate the depression. This is incisive fossa. Now we will see the inner surface of the mandible. So first of all we have mylohyoid line. This line is mylohyoid line. It is a prominent ridge that runs obliquely downward and forward from below the third molar. Okay, this is the place where third molar is present. So from this point it extends downward and forward direction. This is mylohyoid line. Now below the mylohyoid line we have the mandibular fossa, and above the mylohyoid line we have sublingual fossa. Okay, this is submandibular fossa and this is sublingual fossa. So in submandibular fossa we have submandibular salivary gland, and above the mylohyoid line there is a sublingual fossa in which sublingual salivary gland is present. Now you can appreciate this foramen, both side you can appreciate this foramen. This is mandibular foramen. Okay, this foramen is mandibular foramen. Now you can appreciate this four protuberance. These four protuberance here. This is the genial tubercle. There is pair of genial tubercles upward and a pair downward, that is upper and lower genial tubercles. And anterior to this mandibular canal we have a tongue shaped projection. This is called lingula. In both sides anterior to the mandibular canal, a tongue shaped projection or triangular projection called lingula. Now posterior to this lingula we have mylohyoid grooves. This is mylohyoid groove. Both sides you can appreciate this is mylohyoid groove. Now the upper border of the ramus is thin. You can clearly see this is thin, and it is also called mandible. So now see, this is the upper border of the mandible where the tooth socket are present, and this is the lower border of the mandible. It is also called base of the mandible. This is the upper border where the tooth are present in the tooth socket, and this is the lower border of mandible. Now see about the ramus. So ramus is a quadrilateral in shape. You can see it is quadrilateral, it means 4 sides. You can see it has 4 sides. So it has 2 surfaces. The lateral surface, this is lateral surface, and this is medial surface. Inside here is a medial surface and outside is a lateral surface, and 4 borders: the upper border, the lower border, the anterior border, and the posterior border. So upper border, there is a notch. It is called the mandibular notch, and when the base of the mandible extends to the lower border of the ramus, it forms and merge with the posterior border of the ramus. It forms angle of the mandible. Okay, the lower border merges with the posterior border of mandible. It forms angle of the mandible. Now, in the medial surface of the ramus, we have mandibular foramen, in which the mandibular nerve or the inferior alveolar nerve passes through this foramen, and this is mental foramen, in which the mental nerve passes through this foramen. The lower border is the backward continuation of the base of the mandible, and it ends by becoming continuation with the posterior border of the ramus and forms angle of the mandible. You can see both sides. This is base and the posterior surface, it forms angle. Now come to the processes, that is the coronoid process and the condyloid process. This is coronoid process. It runs anterosuperiorly. You can appreciate this is anterior and superior. So this is you can see that this is anterior direction and this is superior direction. So it runs in this direction. It is anterosuperiorly, both side. And this is condyloid process. This head, it forms a very important joint, that is temporomandibular joint with temporal fossa. This, and it is a head of the condyle. This is neck of the condyle. This constriction forms the neck of the condyle, and this is head of the condyle. And there is a depression here. It is called, and this depression is called pterygoid fovea. This both side you can appreciate. This is pterygoid fovea. So this is basic about the structure of mandible. That's it. Thank you.